Hi guys, so in this video we're going to look at pulse checking and do we actually need to check for someone's pulse? So don't forget to watch it all the way through to the end and please hit that subscribe button as well as a notification bell so you don't miss out on any important information. Now when I teach first aid courses, lots of learners still think we need to check for a pulse as a sign of life. Well, this is no longer true. Pulse checking was actually taken out of first aid years ago now, in order to make sure first aid is easy for everyone to learn. So now we use normal breathing as a sign of life. And if someone is not breathing normally and they're unconscious, we would begin CPR as well as calling the ambulance. Now I will leave the links to the video below that I covered about what normal breathing is in comparison to agonal gasps, and also about how to perform CPR as well. So you can have a look back on those either now or after you've watched this video. So therefore, pulse checking is no longer used in first aid to see if someone is alive. Even though you'll probably see it on TV and doctors and healthcare professionals, they would be checking pulse. Well, that's because they're more trained than us as a first aider. They will check pulse and that is fine because they've been doing it for years and they can recognise it. But it can be very hard for us who've never done it before, but it can be very hard for the average person who's done a first aid course to actually recognise what a pulse is, how to find it, etc. So that is why it was taken out, because they want people to look at signs of life being normal breathing. But let's get back to actually pulse checking. Can we still do it? Well, of course you can still check someone's pulse. You can even check your own pulse, but we're not going to use it as a sign of life. So if you know someone is breathing normally, then there is nothing wrong with checking someone's pulse. Because by checking someone's pulse, it can also give us lots more health information. Because any change from your normal heart rate, your normal pulse rate, it can actually indicate a health problem. You know, fast pulse may indicate an infection or maybe signs of dehydration. When we're checking someone's pulse, we're looking for the speed of it, the rate of it. We're looking for the strength, you know, is it strong, is it weak? And we're looking at the frequency of it. Is it regular or irregular? Because sometimes irregular heartbeats could also be an indicator of a stroke. So we have two places where we can look for someone's pulse. We have our radial pulse, which is found in someone's wrist, and we have our carotid pulse, which is found on the side of our neck, either side of the windpipe. And when we check for someone's pulse, we normally check for a minute. But I would probably do it for about 30 seconds and times it by 2 in order to give us that beats per minute. Now normally if someone's conscious, I would go for a radial pulse first of all. Because a radial pulse, it's probably more socially acceptable to hold someone's wrist rather than hold their throat. And also if you can find a pulse on their wrist, it's a sign they've got a very strong blood pressure, you know, at least a systolic pressure of at least 80 in order to be able to pump the blood there. In order to be able to take someone's radial pulse, use your index finger and the third finger, the tips of them, and you're going to place it on their thumb side of their wrist between the radial artery and that wrist bone. You're going to use the tip of the index finger and the tip of the third finger in order to be able to feel the pulse in the radial artery. Now that is located between the wrist bone and the tendons on the thumb side of the wrist. So just apply just a little bit of pressure or enough pressure so you can actually feel each of those pulses. Now you can check for someone's carotid pulse if you can't find the radial pulse, or I would normally check a carotid pulse, maybe if someone's unconscious and we know they are breathing normally, just so I can see the characteristics of that pulse. And we'll find that by using the same fingers, the tips of the index finger and the middle finger, and we're going to just place it alongside the windpipe, and just before that muscle there you can feel in that dip, and just kind of push gently in order to be able to feel that pulse. Now you can't do it when you're talking. And again, you'll be taking this for a minute, so 30 seconds, maybe times that by 2 to get that pulse for a minute. Now you've got the rate of it, the speed of it, but what actually is normal? Well, a normal pulse will have a regular rate around about 70 beats per minute at rest, but that can be higher or lower depending on the fitness and also the age of the person. But a pulse should also be regular, you know, boom, boom, boom. because an irregular pulse can be caused by a number of heart rhythm disturbances. And the most common one of these disturbances is what we call AF. Now, AF means the top two chambers of the heart. We've got four chambers in the heart. We've got our ventricles and we've got an atrios. And the top two chambers of that, what that actually means is they are firing signals incorrectly. Because the heart actually has a natural pacemaker. And that natural pacemaker just sends out regular electrical impulses that causes the heart to contract, which creates our pulse. When someone has AF, impulses just fire off from different places in those two upper heart chambers, causes chaotic electrical activity, which means an irregular and sometimes fast pulse, otherwise known as AF. So why don't you go on now and just check your pulse now? Check someone else's pulse. Have a look what it is when you're resting, sitting down on the sofa, or when you are, just woken up in the morning. Have a look at it when you exercise, because when you exercise, your pulse rate will increase. So just to recap, we no longer use pulse checking as a sign of life, but in first aid, we can still check someone's pulse if we know they are breathing normally in order to be able to give us important information about the rate, the speed of it, the frequency, to make sure it's regular, and the strength of it. And remember, normal resting heart rate on average is around about 70 beats per minute, and it should be regular. And if you are concerned about your pulse rate, your heart rate, or somebody else's, please seek medical help, because there could be medical reasons of why something has changed. And the sooner you get help, hopefully the better the outcome. But please don't worry. But it's nothing wrong with just sitting down, checking yours or somebody else's pulse, and just making sure it's regular. And nowadays, we have smartwatches around of various different types that can actually take our pulse for us. And some of them even have ECGs built in that can actually detect if there's a regular rhythm or not. And it might tell us to seek medical help if there isn't a regular rhythm. Don't forget to hit that subscribe button, guys. Thanks for listening.